You are watching a podcast developed and produced by the Association of Asian Pacific Community Health Organizations, AAPCHO. To learn about AAPCHO, its members, or the principles and values that have guided this organization's work for more than 25 years, please visit www.apcho.org.
October 1st, 2013 marks the day in which healthcare providers and other agencies will begin enrolling individuals without insurance into health insurance exchanges as part of the Affordable Care Act. With less than 4 months away, these organizations, including community health centers, are putting into place outreach and enrollment programs to help ensure that scores of Asian Americans, Native Hawaiians, and other Pacific Islanders across the country can get health insurance. This podcast series, which will include perspectives ranging from federal agencies, healthcare provider staff, and policy advocates, will attempt to shed some light on the issues and challenges facing healthcare providers as they prepare for this October 1st enrollment deadline. Thomas Dudley, Director of Division of Strategic Partnerships, Office of Communications for the Centers for Medicare and Medicaid Services, talks about the resources that CMS has available to help healthcare providers in their efforts to enroll individuals into ACA. So, Tom, what is CMS's overall goal with respect to outreach and enrollment for ACA beyond enrolling as many participants as possible? What are your goals for communities of color and the Asian American and Native Hawaiian and other Pacific Islander population in particular? And what should providers be aiming for?
Well, CMS's goal is to ensure that every consumer has access to and enrolls in quality, affordable health insurance. Communities of color are especially important to reaching our goal, as over 50% of those that are uninsured are persons of color. The Small Health Business Options Program, or SHOP, is also a health insurance option for those that own small businesses. On average, small businesses pay about 18% more than large firms for the same health insurance policy, and small businesses lack the purchasing power that larger employers have. The healthcare law provides tax credits and soon the ability to shop for insurance in the new health insurance marketplace that helps close this gap. CMS and its 10 regional offices, or ROs, are partnering with federal agencies and over 17,000 national stakeholder partners across the country who are engaged to promote the health insurance marketplace. The Asian American and Native Hawaiian and other Pacific Islander group of stakeholders is important to the outreach, education, and enrollment initiative because they interface with the 2.3 million of Asian Americans and 162,000 Native Hawaiians and Pacific Islanders who are uninsured, underinsured, subsidy-eligible uninsured, limited English proficiency uninsured, and millions of small business owners. As for what should providers be aiming for, we want all clinicians and their staff to understand the basics of enrolling through the health insurance marketplace and encourage them to become enthusiastic advocates. Ideally, every office should have a staff member who can help an uninsured patient navigate the process. And we want clinicians and stakeholders to know and understand all of the consumer tools that are now available. The relaunched healthcare.gov website, the marketplace.cms.gov website, and the Marketplace Consumer Call Center.
What are some of the challenges that CMS anticipates as part of your outreach and enrollment efforts? What steps have you taken to minimize those challenges?
We know that many of the hard-to-reach communities, including persons of color, those with limited English proficiency, and those that are located in rural areas. We currently have all of our outreach and education materials in English and Spanish and have several publications about the health insurance marketplace in 9 additional languages, including Chinese, Korean, Vietnamese, Tagalog, Arabic, Creole, Polish, Portuguese, and Russian. As far as what we've done to minimize these challenges, in June of this year, we relaunched healthcare.gov. Consumers will be able to access educational information and learn what they can begin to do to get ready for open enrollment. The site will add functionality over the summer so that by October 1st, 2013, consumers will be able to create accounts, complete the online application, and shop for qualified health plans. The call center operates on a 24/7 schedule and will be able to assist callers in 150 languages. Customer service representatives are available for assistance via toll-free number at 1-800-318-2888 2596, and hearing impaired callers using TTY or TDD technology can call 1-855-889-4325 for assistance.
Thomas Dudley, thank you for joining us today.
My pleasure. Thank you for the opportunity.
This podcast was brought to you by AAPCHO. Please join the conversation on our Facebook fan page at facebook.com/AAPCHO and tune in for our next podcast at www.apcho.org.